It has a passcode on it. It's from the reading from the past couple weeks. I need everybody to do an aerial view. So that what you do is show me your computer screen and behind your computer. Desiree, you're good. We'll just do one by one. Chelsea, go.
I'm not logged in on another device for the quizzes. I've never had to do it for quizzes.
Me either.
Yeah, so
I
you
didn't
have
know
to
we
show
had
your
to do it for
surroundings anyway.
quizzes.
So
So
we
you have
do
to show
have
your
to show our
surroundings. So move the
surroundings?
computer around. Show me with the computer. That's fine.
Oh.
And then I also need you to unblur your background. Okay, you're good, Chelsea. That's all I really need to see. Let's see, here we go. And Jamie. Great. Heather, go. Thank you, Alina. You're blurred too, so clear that up, okay? Lindsay, Frey. Okay, Jamie. You. Good, Portia.
I don't know why it sounds like that. And so am I supposed to be logged into another device?
No, you don't have to be. You can just like show me the computer. Just like put your camera around, like move the computer if you can.
Oh, I mean,
Just to see around you that you're at home. Yeah, that's fine.
Yeah.
That's good. Lakeisha,
Okay.
ready? Thank you. Deja? Deja?
Is these connected to your headphones? To your own phone?
Good. Heather, we did you. Jamie, we did you. Jessica Garcia. Thank you. Kristen, ready? Okay, good. Markeisha. Okay, Alexis. Alexis, you can't be in a car.
Okay, it's the only quiet place in my house right now.
Yeah, we're not allowed to have students in cars.
Okay, give me 1 second,
Okay.
please.
Yeah, you got some time, don't worry. Destiny, ready? Thank you. Shantae.
I don't know. Because
Good. Jimmy Mullins.
no, the Bluetooth for some reason.
Just show me like around a little bit. There you go. Good job, Jamie. Oh, who else do I have to check? Wanda, ready?
Yes, ma'am.
Go for it.
I'm sorry.
No, you're fine. I don't really care what the house looks like. I can show you my basement if you guys wanted to. It doesn't matter what it looks like. I just need to make sure that you're in a safe place where you need to be.
Yes,
Let's see who else are we up to. Markayla. Great, thank you. Alexis, I need your camera on. Oh, sorry. I forgot you were moving from the car. So sorry.
Fine. Do you want to see
Okay.
my?
All right. So we're going to have our quiz. The quiz will take us about 15, 20 minutes. And I will give you the passcode and then you guys start it. What I'll have you do is you can stay logged in so that Zoom records you being here, but you want to make sure that you guys you don't have to sit in front of the camera. You can like turn your video off. Just keep your place on while you do the quiz, after you do the quiz, okay? And I'm gonna have everybody come back at 4:25. Let's do 4:25, okay?
Yes.
So 10 questions, there's one math question. If it says select all that apply, please review them all. It should be. Please don't call out if you have any questions. You just raise your hand. I'll put you in a breakout room. We'll be in shape, okay? Everybody ready to go?
Can I use a paper and a pen or?
No, so you guys need whiteboards and markers, but because this is the quiz, don't worry. You guys can use paper and a pen if you really need to, but if you're going to use paper and a pen, raise your hand now. Okay, so I have to look at everybody's paper before you use it. So everybody show me your paper front and back.
Yes, ma'am. Sorry.
Okay. Okay. Heather, good. Lindsay, good. Portia, you using paper? Whiteboard? Awesome. Chanel, let me see your paper again. Is that an index card? That looks so little. Okay, that's all you need. It's only one math problem. Good job, Courtney. Wanda, let's see yours. There we go. Jamie, good. Okay. All right, so you guys can use that paper if you need to for math. Do not use your phones for anything. If someone comes into the room like a dog or a child, please ask them to leave. Okay?
Okay.
Because I need everybody quiet and no talking during our quiz. Okay? I'm muting everybody, making sure we're all muted. And Avnet, can I see your surroundings? You came in late, so just like show me around the room so I see your home. Okay, good. That's good. Okay, all right, you guys ready? I will put the password in the chat. The word it is capital C, community 0426 is our passcode. Good luck. All right, everybody, if you are around and about, you can come back because everybody's done. We have a couple minutes still, but if you're away from the computer, I'm not going to share too much information right now. We have a busy week this week because we have an exam next week. So please make sure during this week, exam review schedules were sent out on an announcement. Please make sure you attend at least one of them. I will be holding one this evening to review the content for the test. Did everybody see the study guide for exam 1? Nobody's saying it. Okay, thank you, Desiree. Yes. Yes, I record my reviews, but what I will tell you is this, is I record them and that's fine. You can review my recording, but what I would suggest is you going to an actual exam review. Dr. Brown does review the attendance of the exam reviews, and if it comes in question a grade or such, it will help you if you were present at one of the exam reviews. So there's a ton. All different times. Dr. Lundy changed hers. I put that on the announcement as well. So first and foremost, I'd like to welcome those of us that are new this week. We had a lot of people add into our class. I'm going to go over with everyone the expectation is, of course, that everyone's on camera, but it looks like most of us are on there. I can only give you a few minutes if you're not on camera because then you have to go to the waiting room and you're not present. So our expectation for this class is the same as in any of the other community classes, and the orientation that you went through was the same for all our classes. So I welcome you. My name is Professor Aloni. I'll be your teacher for this quarter. I have a lot of years experience in community nursing, and I am currently a school nurse, which is a very different role. But if you have any questions, we will go over them. Anybody who wants to stay after class and chat, we can certainly do that. I will always stay on afterwards. Chelsea, I need you to sign on into your camera or whatever. All right, so what we're going to do is we will go over the group project groups because I sent out an email. Did everybody get it? Sorry, I sent 3 because we had all these changes that went on. Did everybody get the groups? I'm going to share it with you now. And so I want you guys to look at this and see where your name is and see what group you're in, okay? If your name is not on there, I need you to send me a note in the chat currently. I'll go down. We should have 28 total. But everyone should be added and you should see your group number. This was sent as an email. Alina, Alexis, and Amanda, you're going to hide at the top, okay? So we can see everybody else's name. Okay? So you guys are in groups, but you know that. Anybody see anything on there where they're not on there? No? Okay, what we're going to do is we're going to meet each other in our groups tonight. We'll wait, and I need to get through content first, and then we'll meet as groups to make sure everybody's on the same page. You can exchange cell phone numbers, whatever's easier. What I have found with group projects is that it's best to text people. If you're having any problem getting in touch with your teammates, you just let me know and I'll take care of it, okay? Any questions about the quiz? Easy, hard, what was our thought? Lindsay says, thumbs down.
That select all question, was that worth 3 points?
No, every question's worth 1 point.
1 point.
But
Okay.
it's weighted because if you give me 2 out of the 3, then you get partial credit.
Okay.
That will not be the way it is on our exams. You either get it right or wrong in the exams, you know? On our exams, just to go over it quickly, 50 questions, every exam, every question's 2 points. Okay, just as to know. So that's why the numbers sometimes are like 6.25 or whatever for the quiz. So the quiz was really a summary of what I wanted you guys to pick up on this week. I hope that you guys did. I hope you did your reading. How many of us read all the chapters? It's okay if you say so. It's okay. It's our first couple weeks. We got to get used to the swing of things. Don't worry about it. Just catch up on your reading, okay? You guys have a group project due week 3. So make sure you guys are going to be working on that. You have a big assignment week 9. So I want everybody to review that if you can, okay? And we're going to do some content now And then we'll do a little Kahoot together. And what else are we going to do tonight? We're going to review the content and then we're going to do some case studies. Okay. All right. Let's take a look at quickly content because I want to start with that. Okay. I do a PowerPoint. I don't share the PowerPoints because they're not publishable. So just so you know, just keep an eye on it. So we had 2 different types of nursing. What can somebody tell me about community-based nursing? That was a question on your quiz.
Is that the one where they focus on like
Public health.
public health, private health, like all together? Am I thinking about it right?
Sort of ish. What this is, they're managing acute and chronic conditions. So this, we're really dealing with sickness. Okay. When we look at community-based nursing, we're really looking at caring for the illness of individuals and families, okay, across the spectrum. We do acute and chronic care. We have a setting where it's provided, where people live, where they work, where they go to school. And then we have community-oriented nursing, which is not the opposite really, but it's more looking at the health of people. So one is looking at the illness of people, and one's looking at the health. How can we make people healthier? How can we provide a better care of quality of life? How can we diagnose? How can we survey, look around, see what's going on in the community? Okay, so those are the 2 differences really, and that was one of your questions on the quiz, but I want you to be able to establish the 2. One's focusing more on sickness and illness and how are we taking care of that, and one's really focusing on healthy lifestyles, okay? The next big concept you guys had was primary, secondary, and tertiary prevention. You're going to see this throughout the quarter. These are three very important concepts, okay? So as nurses, we always try to help our patients, right? And we're going to be using these 3 levels of prevention. We have a mnemonic, something that you can remember by letters. So primary prevention is when we do something that's going to prevent somebody from getting sick, or prevent somebody from getting injured, or prevent somebody from needing to be in the healthcare system. Anybody have an example from your reading of something that would be primary prevention?
Like seatbelts or vaccines.
Good. Seatbelts. How are they preventing something from happening?
I'm assuming because like if you get in a wreck, it'll prevent more injury. Like you're not gonna bash your head on the dashboard or nothing.
Well, we hope not, right? Okay, good. So it's preventing something from happening. All right, then we have our secondary, and this is really, we see a lot of this in community nursing, and secondary is going to be screening, right? So we're going to be screening our patients. What kind of things do we screen for?
Like
Breast cancer.
mammograms, breast
Yep,
exams.
good. Mammograms, what else?
Diabetes.
Colorectal screening.
Good. What's our colorectal screening called?
Is that the PSA?
Colonoscopy.
Yeah, colonoscopy. Right. PSA is another good one. What's a PSA for? Anybody remember?
Prostate specific antigens.
Good. Yeah. So that's going to screen our people. And then we get to the 3rd level, which public health is going to focus on this. This is going to be our tertiary. Okay. Our tertiary is where we treat. So in order to treat somebody, they need to have a condition, right? So if your patient is a healthy human being who comes into your office to have a well check, what kinds of prevention are we going to do with them? I'll stop sharing.
Can you repeat?
Immunizations.
Good. We're going to check out immunizations, particularly with our babies and our kids, right? What else?
Like sexual history.
Exercise.
Okay. What are we going to do with exercise?
Like ask
Like
them to
making
be
sure-
more active, walk
Yeah.
at least 3 times per week for 15 to 30 minutes.
Okay. So we're going to educate them, right? On the importance of exercise. What else can we do with them?
Educating them on nutrition.
Of course, educating them on nutrition. If a patient is obese, though, and we're educating them on nutrition, what level you think that is?
Tertiary.
Tertiary.
Yeah, it's gonna go either secondary or tertiary because they already are obese, so they already have a problem. So whenever you hear a problem, you should go to tertiary. Some people would say secondary just if they were thinking about it. All right, we're gonna do this Kahoot together, okay? And it's gonna be some examples. I cannot emphasize enough to you guys the understanding of primary, secondary, and prevention. Why do you think we even talk about this? Why do we care?
I mean,
So
so
that
we
we
can
know
know
what
how to
stage,
treat and know
to-
what to do.
All right, Portia, say that again.
So we know how to work with the patients, know what we're looking for, knowing how to educate them and treat them. Right?
Right. We need to look at the patient as a whole, right? This really helps us look at a whole. What if you have a diabetic? What's something you could do for primary prevention on a diabetic?
Prevent crisis.
Show them
Nope,
how.
that's gonna be
Insulin
treatment.
training.
Yeah.
Like
Nope, that's
or-
gonna be
no?
treatment.
Diet.
Exercise, nutrition.
Nope, that's all gonna be treatment because they have diabetes.
Would it be the glucometer?
Food, like their nutrition.
No, not nutrition, not glucometer, nope. Won't be
Prevent
primary
like
for diabetic.
injuries,
Say that again, Chanel.
prevent injuries.
Tell me what you mean.
Like if they, because they're harder to heal, so
Nope, you're still at treatment there.
So with like type 2 diabetes with primary, like he will talk about dieting, exercising.
Nope, that's treatment.
So like, are you meaning like? Cause kind of
they
it, I don't know, like if they have like neuropathy, educating them about wearing shoes in the house or
Yeah, it's still
Would-
tertiary.
Would this
You're still
be
treating him.
like telling them about signs and symptoms to look out for
Of what?
of like high hyperglycemia, insulinemia,
No, what kind of things can we do for a diabetic that's not going to address their diabetes?
Like remind them to still get their flu shot? Is that what you mean?
Excellent. Yep, excellent. Remind them to get the flu shot. We can teach them about their immunizations that they need, right? Like tetanus if they get stuck with a piece of metal. We can do all these things on the primary level, right? Because it has nothing to do with their chronic illness. Once they have the chronic illness, you got to remove that piece of it. And there's so many things we can do for patients, right? That don't all have to surround their illness. So I want you to think about that when you're thinking about primary prevention with somebody that has a condition. Kind of like this. I'll give you another example. Patient with hypertension. Can we educate them on healthy foods for low cholesterol? For sure. And that has nothing to do with their, well, they might, but we're not doing it for hypertensive reasons. Does that make sense to everybody? So it gets really weird because you think like, I can educate them. I can do all these things. Diabetics are always a great case study because there's always so much you can do with them. Just so you guys are aware, I've been a type 1 diabetic since I was 3 years old and I'm not very young. So I've had it many, many years and I hate to teach about it because everybody always has the worst things to say about diabetics, right? Oh, they're going to go blind. Oh, they're going to have kidney problems. Oh, they're going to have vessel problems. Oh, they're going to have all this other stuff. So just keep in mind that as diabetics know this, sometimes if you have a diabetic that's an older patient who's had it for a while, they may actually know more than you, and that's okay. So remember that when you're teaching, you're not going to just say, oh, this person's a diabetic, I'm going to teach them about blood sugar monitoring. Because I can tell you, after so many years, nobody needs to learn about it. They know how to do it. If they're not doing it, then of course teach about it. All right, so we're going to, that was just a little aside because I always have to put my 2 cents in. All right, so we're going to do a little Kahoot together. We're going to practice primary, secondary, and tertiary, okay? I will tell you right now on every single exam you have at least 4 or 5 questions on this. So it's a major, major concept. It will be on your HESI. It will be on every exam you take, okay? All right, everybody know how to do Kahoots? I hope so. All right, let me get to it real quick. All right, so we're going to look at some examples here. Some of the questions are a little repetitive, and we're only going to do a few. And the only reason I even do this with you guys is you probably have access to this Kahoot. I should have posted some Kahoots for you, but the only reason we go through this is because it's kind of a teaching tool. You guys can figure out, is this right? Is this wrong? Why would I think this way? Okay. So that's why we do it. Okay, here we go. It's thinking. Oops. Ready? Classic start. Get ready. Here we go. Here's our pin. 5683307. You don't have to put your real name. You can put whatever you want.
Oh wait, I've never played a live Kahoot. How do I do this?
You just put in the pin when you go to Kahoot.
Okay.
.it and then put the pin in. Somebody but ready graduate. That's funny.
Okay.
All right, we're gonna start. Everybody ready?
Sorry, I'm lagging.
It's okay. The log on will be on here anyway.
Okay.
All right, here we go. Define primary prevention. Here's your choices. Actions that prevent the initial occurrence, actions to reduce the, well, you guys can read. I'm not gonna read to you.
Oh, there it is.
If you need the pin, it's 5683307. Oh, beautiful. I love it. All right, so someone who answered in the red, actions that prevent the initial occurrence. Who knew that was primary and why?
Because it says prevent.
Very good. That's all you need to answer there. If you see the word prevent and they're asking you to define primary, we know P for P. So primary. All right, here we go for our next one. Here's, oops. Here is, this level is primary. Excellent. All right. Medical checkups. Why your medical checkups? Someone who answered hepatitis B. All our vaccines are to be preventing, so they're always primary. But somebody who picked the correct answer, tell us why routine medical checkups are not primary.
They are secondary.
Why? You're
'Cause
right.
that's part of screening.
Yeah. Why do we get medical checkups? So that we look for things. We have lab work drawn, right? We have CBCs drawn. We have hemoglobin A1Cs drawn. We might have cholesterol drawn. We have our blood pressure screened. We get our weight done, right? All these things are screening techniques, right? In order to help a patient identify early on if they're at risk for something. Okay, so that's very clearly second. Very good. All right, we're going to skip the next question because this is another primary thingy. I don't know why there's the same question twice, but I'm going to skip that. All right, self-breast exams would be considered what? Excellent. Okay, secondary. Why are they secondary? Self-breast exams. What are you doing?
It's like a screening.
Yep, you're screening yourself for lumps or bumps, right? Good. So it would not, you're usually not going to see primary and secondary together. It's either one or the other. That's a good way to like kind of X off an answer. And so on one of your exams, there is a question and I'm not going to get into it. Just try to focus on one when you're given a question like this, okay? Primary, secondary, tertiary. Definitely not primary because while it's preventing something from occurring, it's a screening tool, okay? Just like our PSAs. All right, chemotherapy for cancer treatment. What is this? Excellent. And why did we know it was tertiary? What word did we see?
Treatment.
Yepers. We see treatment. We know it's tertiary. We'll skip this one for a sec. I want to get to the next one. All right, this is an example of primary prevention. Excellent. One of our classmates gave us this answer before we even took the Kahoot, so she's on top of it. What would support groups for addictive substances be? What would a support group be?
Tertiary.
Yep, tertiary, because it's treating something, right? All right, we'll do one more. Let's skip this one and do question number 9. Okay, RN advises a client with osteoporosis to have 3 servings of milk or dairy products. Choose the level of prevention. All right, I knew this was going to be a tough one. That's why I wanted to continue with this. Someone who picked tertiary, tell us why.
The person already has the
Most
disease
ratio.
process, so it's telling them to drink milk would be treatment.
Yeah, good. It's giving them what they need. If they already have osteoporosis, they already have a problem. Increasing your dairy products is going to help with that treatment of that disease. Okay. So it's gonna, when we're looking at this, you're never going to have treatment, but not prevention, because we know tertiary is always treatment. So it's a type of prevention treatment. The goal is, remember, for public health is to keep people healthy, right? Is to make people well, to help minimize the complications of their infectious disease or condition, whatever they have. Okay, was that a little helpful going over that? Okay, you guys have that Kahoot, correct? So I want you guys to practice. There's 50 questions on that one. Okay, so you have a bunch there. Any questions on primary, secondary, or tertiary?
What's the name of the Kahoot or
It's on your announcements. It's under your announcements. You'll see there's a bunch of Kahoots. It should be, I think it's called primary, secondary, and tertiary, something like that.
All right.
Yeah, just look at those Kahoots we have. Okay, so that was good. I'm glad we got that concept down. Very good. You guys seem to understand that well, so I'm happy about that. All right, we're going to take a little look at some other things that we went over this week, and then we're going to do some case studies together. Let's get out of here. All right. Point. All right, so we talked about primary, secondary, tertiary. Last week, we addressed Healthy People 2030, right? Did we get to that or no? I don't remember. Okay, well, we'll go over it again. Healthy People 2030 is something that was put out by the government. They want to try to have our health equality and social determinants of health reduced. So we're going to set national goals and we have objectives that measure them. Did you guys have a chance to look over Healthy People 2030? I don't know if I showed you last week. That's why I'm trying to remember. Here, let me share my Healthy People 2030 with you. This is a great website. I would recommend you guys using it for, can you see Healthy People 2030? Just tell me yes or no.
Yes.
Thank you. All
I
right,
don't think
here's
we
what
went
the
over it.
website is, okay? It's from the United States Department of Health and Human Services, and what it really wants is a healthier future for everyone. So it'll give us a bunch of objectives to improve health and well-being, okay? You're gonna have a paper that you do about this, so this is where we're going over it. Did we go over social determinants of health? I don't think last week we did. All right, so you have all these different things that have an impact on people's health and well-being, okay? What do you think this picture would be?
Graduation.
Okay,
Graduation.
so what do you think impacts people's health?
Education.
Very good. Education. What do we know about the lower the education? What do you think about their health outcomes?
Poor
Lower.
outcomes.
Or they don't know too much, so they can't get the good
Right.
healthy results.
Yeah. The lower the education, we see a worse health outcome come out of it. Okay. Could it be because they're not educated? Could it be because they don't know what to do? Could it be because they don't know to go to the doctor? They don't know how to get insurance. They don't know how to get resources. Could be all those things. But we do see specific about that. Then our next one next to it is a little, there's usually, hold on, let me just click on this. We have this next one, which is going to be what?
Healthcare.
Good. Healthcare access and quality. Okay. What do you think happens if you're in a rural community and there's no hospitals nearby? Are you going to be more likely or less likely to go get care?
Less likely.
Less likely.
Of course, right. And it's harder to find care. It's harder to have physicians work in these desolate areas. There's a big push right now to try to get people in rural areas so that we can get better access and quality. Who lives in a rural area? I'll stop sharing for a second. Raise your hand if you're in a rural area. Courtney, how many hospitals do you have?
There we go.
We have one hospital, but we call it a Band-Aid hospital because you can only go there for like IV fluids and stuff like that. Then you're shipped out to Columbus.
Okay, good. So you have one hospital. And what level care is that hospital?
Very minimum. They do have a 2-bed ICU, but they med flight
Oh.
everybody out.
2-bed?
I know.
That would get full. All right,
Very
so
bad.
who's in a city? Yeah. All right, Jamie, you're in a city. Tell us how many hospitals you have.
Over 12. Jacksonville's huge.
Good, over 12. And how many are trauma centers? You don't have to really know. Would you guess if you had a guess?
Yes, I feel like every hospital can support trauma.
Well, they can support it, but so a trauma center would be a certain level of a hospital. So if you, has anybody done their rotations on the NICU, on the NICU? Yes, no, some of you. So on their NICUs, we have levels, right? We have 1 through 4. What does level 4 mean?
Would that be the worst?
No, that's the best
I was about to say,
actually.
I think that's the lowest because Grant Hospital here in Columbus, level 1 trauma center, that's the highest, right?
So interesting, yes. For trauma centers, the lower the number, the better. And then for NICUs, the higher the number, the better. So level 4 NICU will take care of babies who have cardiac anomalies, can do cardiac surgery, open heart surgery on babies, can do neurological stuff. Level 3, they can do abdominal surgeries on infants. They have to ship out though, cardiac usually. They have to ship out. It really depends on what their scope is. But so you look at that and you think about the hospitals near Jamie, and then you think about the hospitals near Courtney. Which one do you think is going to provide better care?
Jamie.
Yeah, because they have more access, right? They have more things and are more available. So that's another part of our social determinants of health, right? And then we have this $, which everybody knows money always matters. And what do you think about money in healthcare?
If you have it, you can afford it.
Yeah, and insurance, people that pay a higher insurance maybe are different insurance.
Yeah, what we see is a direct relationship between poverty and poor outcomes. Because I want you guys to think for a second, if you're living in poverty, which is more important, your hypertensive meds or the door that your apartment or your living?
The
Which is
door.
gonna be, yeah, right? So you think about it, the more money you have, potential, and that's not saying everyone who's rich does great with their health, but this is really a determinant. So it's directly related to it. And then we have neighborhoods and built communities. Why do you think that impacts health? What's a
Having the
neighborhood gonna do?
resources for support, what have you.
Location to the hospitals or like getting there.
Okay, what about quality of what about our environment, right? Like in cities, what do we have in the air that you might not have in rural communities?
Pollution.
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 Yeah, lots of cars, pollution. I mean, if you go to San Francisco, you see a lot of that. So think about that. So that's going to impact their quality of life as well. And then their social and community context. So like, who are they around and what are they doing on their free time, right? That's going to be your social and community. So these are 5 social determinants of health. We talk about it. We will talk about it endlessly. You guys will be totally fluent in it. And so I just want you to think about that when we're looking at that. Okay. We have other topics that we covered that we covered this week, but I'm going to have you guys do a case study right now, and you're going to use the information that you learned this week, and use that for your case study. So what we're going to do is I'm going to send you an email, and you guys are going to, let's just look real quick what I didn't cover. We have a whole bit about vulnerable populations. What do you guys know about vulnerable populations? I have 3 slides on it, but what do you guys know about it?
Usually the elderly.
Yep. Who else?
Children.
Children.
Was it
Possibly.
the LB community?
No, well, I don't know if they're a vulnerable population. These groups of people are like the homeless, low poverty, high poverty ridden, things like that. They're most likely to develop health problems as a direct result of having risks. So what kind of risks are they going to have? They're more sensitive to risk factors because they're often exposed to a bunch. They most likely suffer from health disparities. And we look at the different pieces of them, okay? When we look at a group, we're going to be assessing these things like their finance, diet and exercise, their genetics, their social hazards. And they have this higher risk because they have worse outcomes from their health, from their exposures. So like homeless, right? Like think of multiple transitional housing units, so people are in and out all the time. There's going to be exposure to a lot more. How about jails? When you think about jail, right? There's a lot of people in a tight location. So that's going to be another one that you look at. And so vulnerable populations will cover all quarter. I just wanted you to remember it. You had 3 chapters on family and age-related concerns. Okay, we're going to do a case study on age-related concerns. I'm going to email it to you right now. And you guys are going to use all your great knowledge that you have and help us to solve the case study. So let's see here what you guys are going to get. We're going to take a look at these case studies. There's a bunch. Oops. Okay, I'm sending you guys this now. Okay, so that should come to your inbox. Sending a message. Why my internet's slow today? It's sending the message to you guys, okay? So you should get it in your Canvas inbox. There's several different case studies. We're gonna take a look at them. I'm gonna break you guys out into breakout rooms. You guys are going to do whatever case study you feel like doing. Okay? It's still sending though. It's very slow. I don't know why. Any questions about what we've covered so far?
Are you
Yes,
gonna
no.
post your PowerPoint in the announcements?
No, I can't because it's not published.
Oh, okay.
Yeah. So I just do it so you guys have something to look at because you don't want to just hear me talk and not look at anything, right? I tend to just make a couple PowerPoints on major topics. So what I can tell you is the PowerPoints come from our textbook, but I combine them all together. So take a look at the PowerPoints you guys have access to. Oh, hello. What is it doing? Okay, I'm going to try to send it again to you guys. Canvas doesn't feel like cooperating today, I guess. So I don't usually send our case studies out early because I like you to think about them as a group and work together, okay, to really get to know what you're thinking. So I gave you guys 3 case studies and I just want you guys to know that you're going to work together to solve them. It's going to help because it'll help review major concepts. There was one in there and hold on, let me just send it to you. Huh, finally it's sent. Okay, so we're gonna take a look at what I just sent you guys and we're gonna then split up into our breakout rooms and see. Mhm. All right, so I'm gonna share this with you. You guys should have gotten it in your email. If you didn't, don't worry, it's coming. Okay. So in our first case study, we're gonna look at, okay, it's gonna be health assessments, right? So we're gonna identify health risks for individuals at different stages, and then we're going to identify 2 to 3 healthcare risks for each individual. We have an infant who's 6 months old, born preterm, lives in low income. Teenager, 16, recently moved to a new school, showing signs of social withdrawal. An adult who works a sedentary office job, family history of type 2 diabetes, and an elderly. Okay. And then we have another case study, which is about a school nurse working in an urban community, high percent of immigrant kids. We're going to develop some interventions, secondary prevention, tertiary prevention, and an evaluation plan for that. And then we have a third family that is the Johnson family. They live in a rural community, limited access to healthcare facilities. And these are our 4 people. And what you're going to figure out here again is our healthcare plan. So you guys can pick whichever one you want. Okay. I sent it to you. You guys can edit on the Word document if you want, and then you'll share it with us as a group when we come back together. I'm just going to randomly assign you to breakout groups. Okay. Let's do, how many people do we have? 28. Let's do 5 breakout rooms. Okay. I'll come join you guys and help out with what you're thinking, but let's do 5. And you can pick whichever case study you want. Okay, go. Here we go. What, are you okay? You're like stuck here. And oh, there you go.
How did we end up together again?
I closed breakout rooms
Wait, did
because
you?
we were coming to the end.
Okay.
Yep. So you guys were all working on different case studies, and I was able to check in with a couple of you, but not all of you because of time constraints. And everybody's coming back together, so I'm gonna wait a minute. So we had 3 different case studies. Who did the one on the Johnson family? Yeah, I know Portia's group did. You were in Portia's group, yep. Oh, here we come back. Hold on.
We did.
Yep. All right. Who did the one on the school nurse? Who did that case study? Nobody? Oh, the poor school nurse, all lonesome by itself. And then we had one about the different age groups and what was important about that. Who worked on that one?
Is
Was
that
it the
across
first
the
case
life?
study?
Group 5. Our group
Yeah.
did.
Good. Okay, so in this group, so just so everybody knows, we were looking at people with different ages and different risk factors, right?
Mhm.
What did we worry about with our infant? Born preemie, what do we know about him? Anyone who did this?
They're
And
at
if
risk for infections because
Mhm.
they're premature.
Yep.
what else are
Safety.
preemies? Yep. What
We also
else?
put that because they're in a low income community that they may not be in the best living conditions or receive the most adequate care.
Okay, what do we also know about low income and health outcomes?
Poor.
Yeah,
Yep,
like
poor.
mortality and I
Mhm.
don't know.
Yeah, and preemies tend to have lots going on. What do you think about with a preemie? Well, who else does that impact?
The mom.
The mom, yeah.
The
The
family
mom, the
member.
dad, siblings, right? Any of that.
Mhm.
Because they're very little. Sometimes they're not able to handle what a full-term baby can handle. It doesn't say how preterm, it just says preterm. I want you to be very careful with that low-income community. We know that the health outcomes are going to be worse. Maybe, we don't know, but are the parents educated? If they're not educated,
Yeah.
those preemies need as much as they can get, right? So we think
Yep.
about the resources there. How about our teenager, 16, recently moved to a new school, showing signs of social withdrawal?
We
uh,
alcohol and drugs.
Okay, tell me what you're thinking.
we put we put alcohol, drugs, maybe abuse in the home, mental status, like they may be depressed or going
Yeah.
through a body image phase.
We have a lot of violence at our teenage years. We see a
Mhm.
lot of violence. That's a big concern among our adolescents. Okay. Think
Mhm.
about your adolescents that you know. What are some things you worry about? You worry about mental health, right?
Yeah.
Yeah.
Depression, anxiety. I don't know if anybody work in a school. Alexis, well, you're with that one student, with the one patient who's young, right? He's kind of youngish. Yeah. So with our teenagers, anybody have a teenager?
Yes.
Yes. So tell me, all of us who are parents of teenagers, what do we know teenagers think of what's going on?
They think they know everything.
Yes, for sure.
And
They know more than
they think
anybody.
they are invincible.
Mhm. And like, what do you mean? I don't need to listen to rules. I make the rules, right?
Yeah. Yeah.
They really like to try stuff out. So they like to try sexual activity out. They like to try
That's what we were thinking with the
vaping.
alcohol and drugs, maybe peer
Yeah.
pressure with the
Yeah, so we want to worry about that with our teenagers because they will be sure to tell you what they know and how you don't know anything as a mother of a teenager, right? A lot of
Yeah.
times they'll tell you, and my daughter says this words all the time. She says, "You have no idea, you're too old." And that's it. She truly means it. I'm like, I didn't think I was that old, but okay. So just think about that when you're thinking about our teenagers, things you worry about, right? They don't know about, they're not necessarily worried about sexually transmitted diseases because they also have a feeling of being what? You guys know? You kind of spoke to
Invincible.
this.
Like
Yeah,
a-
exactly. Exactly. Invincible. They think,
It's not
nothing
gonna
happens
happen
ever.
to them.
Exactly, right? So and I mean, nice to be able to think that way, but that's just not the reality. All right, we have an adult, she's 45 or he's 45, works a sedentary office job, has a family history of type 2 diabetes. What do we know?
The sedentary office job combined with the family history of type 2, they could be at a higher risk of like cardiovascular problems.
Good. We worry about
DVTs.
cardiovascular.
So you would want to teach them about like exercises and range of motion, things they
Mhm.
could do.
Nutrition.
Mhm.
Okay, well, good technique with these sedentary office jobs. Does anybody know what it is? To get them up and moving?
Don't you like stand up every 50 minutes?
Put a timer on
I
your
was gonna
phone or
say
your watch.
standing, maybe while at the desk.
Yeah, that's good. Standing desks. Tell them to take a walk,
Mm-hmm.
Yeah.
right? They take a 5-10 minute walk every hour. They'll be, they're moving their body. Type 2 diabetes, what do we know? Who's at high risk of that?
Obesity. Yeah, obesity.
Mm-hmm.
Never exercise.
Hypertension.
Family history.
Poor eating habits.
Good. All of those. So, you're really cautious or sensitive when you have a family history, right? Because we know
Yeah.
genetics plays a huge part in healthcare today. So these are the kind of things we're thinking of. And this is good because this was a whole chapter you guys had this week. And it was about age appropriate concerns, right? And you guys are hitting them on the head. Good work. All right. How about our elderly guy? He lives alone, has a history of falls, and forgets.
Malnutrition.
Why malnutrition?
They forget to eat.
Memory loss and maybe not access to food or to the store.
We also put that he may have like dementia or onset Alzheimer's.
And they're not, there's no predictability, right? So you don't know what they're going to forget. So we talked in one group. What do we talk about the meds? What are we going to do with their meds? Make sure he's taking them.
Just
An alarm.
alarms, stickies, just kind of like reminders for them to help them remember when to take
We're
them.
going to be really sensitive to our elderly and what else? Meaning, what happens to them?
Depressed.
Starts with an A.
Wait, what was the question?
What do we worry about elderly? Starts with an A.
Alzheimer's?
Abuse.
Abuse. Yeah, remember the abuse. We get financial, we see financial abuse, we see emotional abuse, right? We see caregivers who don't want to take care of them. They get tired of it and they say, I don't want to do this anymore, right? So think about that with our elderly. Lives alone. That's a concern. Why?
What if they fall and nobody's there to know?
Yes, risk falls, and then they forget to eat. They forget to take medications.
Sure.
And
Forget
depression.
all that.
ADLs.
And they forget ADLs. So we're going to be really worried about this guy. If he lives alone, he's got a history of falls, meaning he can hurt himself, and he has mild memory loss. So we have a lot of health risks here that we worry about, right? And we talked in one group about the refrigerator. What did we say about the refrigerator?
Making sure it's of the right temperature.
Older people tend to keep food for a very long time, and they don't check their refrigerators. Right? It's sad, isn't it sad? At the end of, you've given your whole life and you've worked so hard your whole life, and then at the end, sometimes people are just treated like awful. It just seems like not fair, right?
Yeah.
But what I want you guys to be aware of is people who say, I'm taking care of my dad's finances for him. I'm sure we all know a story of someone who's taken over their parents' finances and taken them to the bank, right?
Yeah.
All right. Then we had one where one group did the Johnson family, and this was like a lot. There was a lot going on with this family, right? Low income, living in a rural community. The one has asthma. The other dude has hypertension. Lack of transportation. The little girl misses school all the time. So we had a lot going on with this family. What were some of the factors that we were concerned about? Like, what were some of the environmental factors that we worried about?
Like their lack of transportation, their
housing, conditions.
Yeah, their overall environmental conditions related to their health conditions like the asthma and arthritis.
Good. And we talked about their financial situation. What kind of strains does that put on? What do you think? If they don't have money, are they gonna go to the doctor?
No,
No.
they were missing like their medication, the doses, especially the man, he wasn't taking all his hypertension doses, medication.
Right, James wasn't taking his hypertensive meds. That was something to worry about. We know that that would increase his risk of stroke or heart attack, right? So this is going to be a big impact. Lisa, the mom, she's getting caregiver burnout. She's tired of taking care of everybody. What does that do? And we talked about stress as nursing students. What does stress do to your health?
A lot.
It's sad to say, but I know nursing school is very stressful. So your guys' health probably isn't as good as it could be, right? As when you're not in nursing school and having so much pressure and stuff on yourself. So good. That was just the family health risks. And we saw how all different age groups, right, had something going on. So that was a good case study to come to. All right, it's 5:30. I usually let you guys go because I don't give you a break. So I'm going to do that. What I want you to do though is promise me you will be in touch with your group throughout the week. Okay. I am running a exam review at quarter of the hour. So if you can join. Don't worry if you can't. Don't stress. I'll put the recording out there. Please watch the announcements this week because as each recording is made, I will post them. So you have access to them. It's a good review for the test next week. All the content we have covered from social determinants through primary prevention, through family, crisis, and different age categories. That's all free game for the test. If anybody wants one-to-one private tutoring, please let me know. I'm available throughout the week. I can do that for you. Any last minute questions?
You hosting your exam review today? Okay.
Yeah, in 15 minutes.
And this same Zoom link?
Yep.
Okay.
Okay. And I just want to let you know that I encourage everyone to go to as many exam reviews as possible for the first test. For next week, I need everybody to have 2 appliances, a phone and a computer. You're going to have a practice test on Exemplify that you have to do prior to next week's class to make sure that your computer is running up in par. So keep an eye for that. I'll post it for you guys. Any questions about the quiz? I mean,
Can I
test,
stay
sorry.
after class to talk to you?
Yeah, sure.
Thank you.
I'll be on. You guys are free to go, but I will see you guys next week.
Okay. Thank
Have
you.
a good week.
You too.
I had sent
I'm gonna log off and then I'm gonna come back on for the review.
Okay.
You said about 15 minutes?
Yepers, I do quarter of.
Okay.
So 6:45 or whatever, 7:45, whatever time.
Okay.
Okay. Do you guys all want to talk to me?
I
Okay, I'm
do.
gonna put it. Yep, no worries. So I'm gonna put you all in private breakout rooms and I'll come join you, okay? So that we can have privacy.
I was gonna stay for the
Review?
is that okay?
Sure. I'm gonna stop recording anyway. You might as well log off and give yourself 15 minutes. Go to the bathroom, get something to drink, whatever.
Okay.
You know what I mean?
Yep.
So you're gonna be tired of hearing my voice. All right, hold on one sec. Let's get you guys a breakout room.
Oh, don't drink. Baby, don't drink it. Oh.
All right, welcome everyone to my exam. Oh, hold on. I have to stop